spectacular.
Yeah.
Okay, I think we should just get started.
Okay.
And like Esther said, it is being recorded, so you will get a copy of the recording. And then those people that are joining late can either join late or they can go back and actually watch the recording.
Okay.
All right, here we go. So thank you everyone for joining us today and taking the time out of your schedules to spend it with us. We very much appreciate that. And in regards to time, we're going to try to respect that time. We generally have about an hour and a half of a presentation. Yesterday's presentation, they all kind of gasped when I said an hour and a half. So we had to reduce it to an hour. So we'll try to keep this one down to an hour, which we'll be able to get through. We're going to describe what senior care access is. We're going to describe what the vacancy program is, which is what we're going to be really discussing today. Then we're going to get right into the web portal so that we can show you the extensive data that is accessible to you. And that data is the basis of the site itself. At that point, you'll probably be full of questions and comments, and we will offer to answer some of the other questions that we've collected in other presentations in order to help answer some of the overlay questions that you might have. We're going to describe who the ideal patient is so that you'll be able to easily identify them. And then finally, we'll just open it up to your questions and comments if we haven't answered them at that point. Okay? Does that sound fair to everybody? Good. I'm just imagining everybody with thumbs up. Good answer. All righty. Let's get this one on here. Sure. Now there we go. Let's go back. Here we are. Okay. Can you see our screen now? The next one, Esther?
Yeah, I can see it.
Yep. Okay. Perfect. So there we are, the handsome couple. Wait a minute. No, not really. But so Esther and I together, we own Lifestyle 55 Plus Network. I'll talk a little bit about myself just to give you a background as to where I'm coming from, and then Esther will share a little bit about herself and where she's coming from as we come together to offer senior care access. So I also own a company called Pivotal Aging Innovations. I'm also Canada's first master accredited senior agent as a licensed realtor. Through the organization, we offer training under the Seniors Real Estate Pivotal Accredited Senior Agent brand. And we do training for realtors across Canada in working with seniors in transition. We have a senior-focused real estate and referral program. We also have the Pivotal Seniors Real Estate Group, where we actually conduct real estate and transitions ourselves. Pivotal Aging Innovations, the other partner that I have, she does a lot of work with Ministry of Health Long-Term Care's mandated policy and procedure requirements for long-term care and retirement homes, as well as person-centered care and the Ashby memory method for early to mid-stages Alzheimer's and dementia. That is a very, very brief rundown of what we offer at Pivotal. But today is not about Pivotal. It's just to give you an idea of who Esther and I are as we get into the actual website. Esther, do you want to share a little bit about yourself there?
Sure. So for 12 years, I worked as a hospital social worker in Toronto. And I ended up being the social worker on what we called at the time the transition service. And it led me to develop an interest in the retirement home sector. So in 1977, I actually created a resource directory that over the past 22 years has evolved to be the Comprehensive Guide to Retirement Living, which some of you might be familiar with. For years, we distributed the book to Humber River, and also created senioropoulos.com as the website that went along with the book. So over the last few years, I keep getting approached by professionals who want more information than what we have on Senioropoulos. Because, and we'll talk a little bit about this, all existing websites before Senior Care Access had a bias to them because homes paid to be part of them. What we found was that the data we didn't have was more and more evident. And so I was approached repeatedly from people who wanted me to give them access to the information that wasn't available on the front end of the site. So I decided to create a new site, and the idea of it was that homes would be on it for free and members would pay to access it. So I started with Senior Care Access, and then I met Paul. And we started talking about the options of what I was offering, and we decided that it could be so much more if we combined what we both were good at and what we both knew. And so we relaunched Senior Care Access in a little bit of a different form. It still maintains the member base and the free access for homes to be part of it, so that we have this really extensive, thorough database of housing resources. And I do other things. I teach, and I am the chair of the Stakeholders Advisory Council for the RHRA. I am on a board member of another organization, not-for-profit, and I do a lot of educating with different groups of people around retirement home options. So that sort of just gives you an idea of where I'm coming from with all of this.
Yeah. Esther, I think today on today's presentation, we should touch a little bit more about the consulting program that we offer.
Absolutely. Yeah.
Because yesterday we didn't have enough time, and then we had those questions at the end that if they were aware of that, it would have been a whole lot easier. So,
yeah.
Okay.
Yeah. So,
okay.
do you want me to mention it now, or we'll come back to it?
No, I think we'll get to it when we get to the actual website.
Okay.
Back up here. Okay. So the web portal itself, we're going to share Senior Care Access and the Vacancy Program. Has anyone on the call heard of Senioropolis? Now, Esther was talking about Senioropolis. Have you all heard of Senioropolis?
Yeah. Yeah.
Yes? Okay, so you're familiar with that. How about Comfort Life?
Sorry, say that again?
Comfort Life.
I haven't
Nope.
heard of that.
Okay, no problem. How about A Place for Mom?
Yeah.
Oh, yeah. How about
That's
Pearl's
interesting.
Choice?
No, don't know that one.
No. Okay. These are the four main players in the retirement home placement industry, if you will. The underlying or the common theme between all of them is that they only show or deal with properties that pay to be listed. Okay. Now, Esther touched on this, and it's really important for later as we get into this. But just remember that all the opportunities that you see on Senioropolis or anything that A Place for Mom gets involved with, they only deal with properties that pay to be listed or pays their commissions. Okay. Now, fundamentally, that's a problem. I think it's a problem because you're not delivering an unbiased result to your patient or to your client. So that is one of the bases of Senior Care Access, is that our database is 100% unbiased, and it's clear across Canada. Okay, so basically what we have created is an advanced platform for professional access to the senior housing data. Okay, and that data covers retirement homes, long-term care homes here in Ontario, seniors apartments, supportive housing, and alternative solutions. The retirement homes data covers Canada-wide, and again, that's important for later because if you are a professional in, say, BC, but you're dealing with somebody that may need to be transitioned or with a family member from another province, you'd still be able to access that data. Okay? So because they do not pay to be included, this is Canada's first unbiased database of senior housing solutions. Okay? It's offered as a professional member model, so it's quite complicated. Once you see what we're going to show you, you're gonna see just how many data fields we have. It's professional member because really it's the professional that understands how the system works. If we were to just put this out there for the public, all the public knows is it's a retirement home, or it's a seniors building, or it's an old age home. They really don't know what the different levels or the different terminology are, or the different care options. Okay, So because of the data that we carry, we are offering this to a professional member model. It also offers the consulting program, which we're going to talk about. And that program is available for families and individuals in transition. And it offers a networking, referral, and marketing database across Canada. And we're going to show you a little bit about that. And this is an area where professionals offering services to the seniors industry can actually be added to the database of services provided. Okay. The entire program is delivered through online access. And of course, we're also offering the vacancy program, which is why we're here today. Okay. Esther, you want to share about some info about the vacancy program itself?
Sure. So we have a new platform with first of its kind vacancy program. The reason we're here today is to ask that you and your staff consider piloting it with us. The program's been designed really to bridge the private sector with participating, the public sector with participating private sector housing and care solutions provided by retirement homes. We developed it to assist with patient flow, to assist social workers and discharge staff with a single, simple to use alternative care housing placement tool. It's unbiased, and Paul has already mentioned this. Professional member access, and it connects retirement homes with vacancies to qualifying patients that are in hospital. We hope it will improve your staff's investment of time, improve your patient flow, reduce the number of patients returning back to the emerge because they don't have adequate support at home. And we hope it'll improve the quality of life of the social worker, the patient, and the family. This is really, really key for us because I have been in your shoes and I know how long it does take sometimes to find a good alternative for somebody. So with our system, we're hoping that it'll speed up the process tremendously and allow you time to do other things besides this kind of research. So seniorcareaccess.com is not limited to one aspect of housing only. It's not just for short-term or respite stays, though we see this area as being the important one for your immediate use. The program lends itself to comprehensive data that allows patients to make an informed decision on short and long stay housing solutions. So it could be short stay respite, it could be long-term retirement, could be supportive living, or even long-term care. And while we know that the LHIN controls long-term care placement, we also know that there are situations where external insight into catchment areas beyond yours is important for you to access in order to design a care plan for patients that may be outside your immediate area. As well, our vacancy program for participating Toronto retirement homes is one of a kind. No one else has tried this before, and it really will give you important information to assist you with private sector placement. So we want to show you the site now. Just walk you through really quickly and show you how to use it.
So just before we flip over to the site, I'm challenged in explaining this bridging program when we are presenting to a retirement home or a retirement home group to a public sector hospital setting type of group. And every time I try to explain it differently so that it's a little bit of clearer understanding. So we have the public going into a hospital setting, looking for and expecting care. And that care is basically provided at no charge because it's funded by the government, okay? Yes or no, how much of it, that doesn't matter at this point, but that's what their expectation is. On the other side, we have the private sector who has built, paid for, and is looking for revenue through the rental opportunity with care to typically older adults. That industry is very secretive in that they will never disclose how many vacancies they have. And being on the inside, because that's the side of the business that I'm bringing to this, we've gone out, we've connected with many homes, we've introduced the vacancy program, and we've said, listen, if you want to get your numbers up and increase your profits, et cetera, let's take your vacancies, and if we set it up correctly, we can connect it and bridge it with the hospital, whose patients may be looking for and can afford this type of temporary care. Okay, and we're going to talk more about what that care looks like. But just think of it that way, is that as you discharge your patient, could this opportunity be a potential solution for that individual? Okay, and again, we're going to talk about who the ideal patient is. It's not for everybody, but for those social workers that are front line in doing this type of search and placement, that's who we really get our feedback from. Okay, so I just wanted to make that a little as clear as I could, I guess. So Esther, we're going to go into the website, and if everybody just bear with us here, I'm going to stop share. There it is.
And I'm going to share mine.
You're going to share.
Okay. Tell me when you can see it.
And give it a second, and here we are. Okay. So if I can see it, I guess everybody else can see it. Okay. So the first thing that you're going to notice as we enter the website is that the logo is different. We are currently updating our logo. It will be in line with what you're seeing on the actual presentation piece. This was a natural development for us. And so when you come back to the site in probably 3 weeks, it's going to look a little bit different, but you're still here. Okay. The second thing that you will notice is that we've created it to be extremely simple to use. In fact, it lacks all of the fancy website stuff that you're typically used to, because it's based for professionals to access data and for the resources for professionals to access. It's not about social media or unnecessary distractions. Okay. Now, the ease of use directs you to simply 3 entry points. Okay. The first one on the left, professional access to senior housing details. This is where individuals such as yourselves would enter the site. And if you actually clicked here on that box, it'll give you more of a description of who the user for this part of the portal would be. Okay. The center part in the cream color, consulting services for individuals and families. We have a consulting program, and that consulting program enables families and individuals to work with us in getting their immediate questions of who do we talk to, what services are available, what are we going to do, how do we do this, and basically who's going to help us. About what is the real question. But because we deal with all kinds of transitions, we can basically take a client who, an adult child who's caring for a parent who's gone in for surgery, who's not recovering well enough and is being discharged and has no way of taking care of them at home and doesn't even know what to do in setting that up. Or we can have something, as I mentioned previous to starting this, because we run the seniors real estate program, we could take an estate, perhaps, for example, mom passed away, children now have the property, have no idea what needs to happen, what lawyers to talk to, what probate means, who's going to be in charge of what, and how to actually get the property sold so that they can move on with their lives. Okay, so we can cover a huge array of concerns for families. Okay, the difference here on the consulting side is that the consumer or the user pays our fee. This is the only way it can remain unbiased. If we don't charge the consumer and we rely on getting paid by the solution, then obviously the solution is what we're going to offer the client. And that may not always be in the best interest for the client or the patient. Okay, so it's we're kind of turning the industry, that consulting industry, on its head a little bit, because it's a very different model. Okay, and then the last piece on the right-hand side is access to senior service partners. And this is a cross Canada database that we are currently building, where professional services can list their services based on the province, their city, and they're given an exclusivity to a maximum of 4 results. So if a professional like yourselves are trying to help a patient and they're looking for additional services, they can either come to our consulting program, or you can go directly to the Senior Service Partners page, locate the city that the patient is going to be in, because they may not be in your city, look up the services available, and then offer the contact of those 4 businesses that are listed there. Okay, so basically those are the 3 areas of entry into the website. For today, we're talking about the first part, which is the professional side of things.
Okay. So let's show you how to use it, right?
Right on.
Okay. So you can log in from 3 different places on the site, on the homepage. The first is, if you click on search, it'll take you to the login box. If you go to the bottom of the page, you'll see there's a box that says member login, makes it really easy. Or way at the bottom of the page, right at the footer, there's also a member login. So I already logged in to just be able to speed things up. So once you log in, this is what you'll see. This is a search page. And the wonderful thing about it is, if you know what you're looking for and it's just pulling up a name, you can type it in and up it'll pop. Or if you want to narrow your search because you don't know a specific home, you can use our advanced search box. So the way it works is, you start with province because it's Canada-wide, and you go to city. Now we did have a drop down. We found it was a little bit difficult to use.
Cumbersome.
Yeah, cumbersome. That's the word. So we have just changed it to a where you type and it recognizes. I don't know what the word for it is. So we can just go Toronto, because that makes it easy. The homes that are currently participating in the vacancy program are Toronto homes. We have about 40 on board. If you find a home that you want and you don't see that it has a vacancy, it doesn't mean it doesn't. It just means that that home has chosen not to participate at this point in time. Okay, so once you get there, you could search by residence name. If you just go show all, it'll actually show you every residence in our database, not just retirement homes in that area. If somebody comes to you and has the name of a street that they want to know about a home from, all you do is you type in a street name and all the homes with that street name would pop up. So that's a really nice feature. And then you would select level of care. Now, what you need to know is, the more levels of care you select, the narrower your search. So for example, if your goal is to find a place that has a long-term care home and a retirement home in it, if you select both of those things, the only homes that are going to come up are homes with both of those things in them. But if you just want to know where there are retirement homes to broaden your search, you would just click on retirement home. And here's where the vacancy box pops up. If you click with vacancy, all you're going to see are the homes that have told us they have a vacancy somewhere. Now, you can also look at other things. So if you'll see, first of all, that we have a ton of different levels of care, absolutely a ton of them. The reason this is a professional-based membership is because any consumer coming and looking at this would absolutely not know what to do with it. Most people do not know the difference between retirement and long-term care. You just don't. It's not, until you're in that position, you wouldn't know what it is. But if you don't know what one of these terms are, you can just click on the document that's here on this page, and it'll open up, and every level of care is explained in that document if it's something you're not aware of. So the other things you can search for are things that we believe people need to use to narrow their search. So for example, if you have somebody who smokes and wants to be able to smoke indoors, it's going to narrow your search tremendously. I think I only know of 1 or 2 places that actually allow that. So just to keep that in mind, that all of these criteria are going to narrow your search. By the same token, though, they're going to give you what you need really quickly. For the purposes of argument, though, just so that we can illustrate what this is doing, I'm just going to submit it with Toronto retirement homes with a vacancy. What you're going to see is these are all the homes that have told us they have a vacancy. So that took about 3 minutes or less, 3 seconds.
Yeah.
So let's pull one of them up. Let me see. Let's go to Davenhill just for, okay. So this is going to give you an idea of the scope of the information we have. So you will find in this the levels of care, where there are vacancies within these levels of care, when it was last updated by them, what the costs are. I mean, these are just huge bits of information that you wouldn't normally be able to access unless you phoned them and left a message and they called you back and then you went through it with them. This is where we're saving you time. We've also created a generic application form. If you pop open this form, it'll download to your desktop and it will have filled in your name and the name of the home. Nothing else. And then from there on your computer, you can fill out the form and send it to the home so you can determine in advance if this person would even qualify to be in the home. So that's just something we've done to make it a little bit easier for people that are using it. What we will be creating soon is the ability for homes to upload PDFs. So they can be uploading their own forms and you can just take it straight off the site and send it to them. So that's coming soon. So we know pricing now, we know how many beds they have, we know the levels of care. Really important to know if they have memory care. Within that memory care, what do they offer? Special programs? Is it a secure unit? Do they have a wander alert system? These are becoming more and more important questions, especially as we're finding more people with this need and a lack of ability to access beds in the system, in the public system, quickly to accommodate this. And so the private sector is stepped up to the plate. Unfortunately, though, the cost is quite high. So that's an issue for so many people. So we know what it's close to. We know the kind of cultures, languages. I always felt this was a big issue because where you have many cultures in Ontario, in Canada, that are coming here and living here, and things are changing and the family has to find appropriate placement for them. Language is a huge issue, as is culture, as are special menus. So these are things that we highlight and that we ask the homes to give us information on. So you now know about the menus, you know all the amenities that they have from this. The kind of staffing, I mean, it's quite endless. To be honest with you, we have well over 350 fields in our database, and that's to accommodate all the different options for housing that we have. The other really interesting thing that we've created for this site that I've never seen anywhere else is the ability for our users to create a private note for themselves attached to every home. So if, for example, you've talked to somebody there or you visited this home and there's something that we don't cover that you want to be able to remember about this specific home, all you have to do is hit create note. You type it in, only you will ever see it. No one else will. And there's a way at the top where you can actually access, if you go to your member home, you can access all the notes that you've created. You can also favorite any of the homes in the list by pressing the heart. That pressing the heart also allows you to print contact information for these properties. So in the event that you have a family member that's going to go looking, you can heart 3 or 4 of them, print it out, then they have the list of homes with the contact information in it, and then they can go and start investigating. So that's giving you that extra piece of opportunity to share that with clients. Is there anything else I've forgotten about this, Paul?
Say again?
So the membership piece.
Yep.
So right now, you guys are all free members. We're not charging anything. The goal is to get data. We would love to know if this is working, how it's working, the kinds of things that you find helpful. If there are things you think we need to add, we'd love to know that as well. We're always open to hearing feedback on what we're doing, because we're not using it every day. Sometimes you'll have a different opinion and have information to share with us. I did send all of you a feedback form that we created. We have had some hospitals find that very helpful. Others have said they would rather provide feedback in a different way. So they're either emailing us, or we have one contact person who is gathering information as it's coming in and then sending us an email once a week or once every couple of weeks with the feedback from the staff. So we don't want to make it any more difficult a task for you. We don't want to add paperwork for you. We just want to know what we need to do to make it an even better tool for you. And I think
basically this is the pilot program. So we're here, we're all in training for this so that we can make it something. And like we said earlier, bridging between the private sector and the public sector through this program. But we need your participation so that we can test it, feel it, change it, go back to the retirement homes, get their feedback and see what specifically they want that might be different. There's a huge difference between the two parties. So we're looking for participants to assist. We can literally see this going across Canada as part of the retirement homes services that they would offer. And it's a great way for the local homes to communicate with the local hospitals. Right.
So the other thing is, this site is not only about retirement homes. What we're presenting to you is the vacancy program for retirement homes. Currently, we have information on long-term care also. So all the Ontario long-term care homes are listed. And the reason we did that is you may have people that are with you from outside of your catchment, and they may have questions about what homes are in their area. By the time they get connected to their local LHIN, it may take a while. So you would be able to say, here's a list of all the homes in your area, and here you go. Contact them, find out when their tours are. So it gives you a little bit more information to hand them. The other information that we've already loaded on are apartment buildings for seniors and supportive housing for seniors. As time passes, in the next few months, we are also going to be adding condos, life lease, and every other senior-friendly level of care that we can locate. So even if you don't need it for retirement, you may eventually need it to help a client find an apartment building in their area. I know for me, I have spent a lot of time looking for apartments for seniors and being able to give them names and locations. There is no one database anywhere that provides you with that. So we're that database now.
Yeah. In addition to that, even with the support of Peace or the seniors apartments, buildings, or condos, because we bring the real estate component to that, perfect example, we have a building in Mississauga that we regularly work. It's attached to a retirement home, but it's not the retirement home. So it's privately owned units. The people coming in there are 65 and older. Typically, they're coming in from a house. They're downsizing into this seniors condo, independent living, which they own. And the reason why they're coming there is because it's also close by to the retirement home, and it's a 2-minute walk to the long-term care home. So for a lot of these families who know that the future is going to be very challenging health-wise, they're looking for this type of property that will be available to the family, right? So either you come to us from the consulting side of things and we can help out, or if you're going to be doing it, then there's other ways through our database for you to find that. Okay. If I could just ask whoever is doing the dishes to maybe just stop for now, just so it's not distracting to everybody. Or not. Okay. Esther, anything else on the website?
Hello?
Esther, you there?
Yeah, I'm
Yep.
here.
Yep. Anything else on the website you want to share?
No, I think I'm good.
Okay. Just for time's sake, we're not gonna go into too much more of the website, but you're free to come to the site and play around with it, go through it. You can do a trial search where you'll get a three results, 3 property result that would come up. Nowhere near the extent of what you could get if you were the member. But as Esther said, she has will be forwarding you your codes.
They all have it.
Yeah, so you'll be able to get right in there and do your own search and start seeing what that feels like. Okay. Okay, should we flip back to the presentation?
Yeah, so I'm going to stop share.
Alrighty, we're just going to stop share there. Back to here. Let me know when we're up.
I can see it.
Okay. All right, so what we want to do is address some of the questions that you may have at this point about what makes us different, unique, or special, because we know that you already have your own resources that you typically use to access housing and resource information for your senior clients. I'm just going to check to see who's making all the noise here. See if I can mute them.
It might be me.
It's a lot of noise behind you. Sounds
There
like
might be.
somebody's
I'm
moving
trying to
or
get
something.
to. Okay, so I shouldn't be moving now. I was trying to get to a location where there's no noise.
Okay, gotcha. All right, so let's start addressing
Okay.
some of the issues that we've come across with different groups in presenting the pilot program. So the first question is, offering a retirement home for respite or short stay is too expensive. Anybody agree with that statement? Everybody's muted, so they're going to have a tough time answering that. Okay, well, here's the answer to this. First off, don't be the judge of that, okay? This program will suit a certain percentage of your discharge patients, and being able to offer unbiased solutions is what should be offered to patients. So if you break down the cost of organizing home care, making any alterations in the home, involving the family, and the possibility of isolation, offering the family the options will only empower them. And then this way, they can make the final decision. So this is not the solution. It is one of the solutions that is what we are targeting. Okay. This would be you saying this. We already have access to partnering transition beds. Okay, so we know that there are some transition beds in the system, such as Pine Villa, Humber River, the Reactivation Center at Jane and Finch for the Central LHINs, but not every hospital has access to them. And even if they do, they may be full. You also don't have access to how many beds are available at any time, or a patient may not want to go that route, but it's still a solution. Okay. Esther, you want to take this one?
Yeah. So, there are a standard 7 options that every social worker can go to if they're in a situation where you have a senior client who's being discharged and needs a bit more support. We know that people can go home with family support. We know that there's LHIN support. We know that you can get paid third-party home care services. Again, these transition beds are available in the system. You can extend a hospital stay. You can wait for long-term care, or you can go to a retirement home for respite care. It's this option that we're targeting because for the qualifying patient interested in this solution, our vacancy program allows for a simple referral with a pre-identified vacancy and care service. So we're not offering another solution. We're offering an easy access system to unbiased solutions for you.
For your patients, right? Okay. Esther, if that noise is coming from behind you, you might want to mute yourself and take care of that and then come back. I'll take this next one.
You know what? I'm going to say mute me, and I'm going to try and move to a place where there isn't noise. I've been moving around trying to get that place, but I've got activity around me.
All
so
right,
just
fair
mute
enough.
right now, and I'm going to move. Yeah.
So let's mute you. Okay, so apparently it was Esther making all that noise. Okay, next question. So this is something that you would be asking. We already have a huge amount of paperwork and overwhelming caseload. So while this solution will not change your caseload, we believe it will give you a better quality of life, as it will decrease the amount of time you spend finding a viable solution for certain patients, basically freeing you up to deal with other things or to go home without extra paperwork, not to mention increased patient flow and bottom dollar for the hospital. Okay? Again, anything that's new is scary. It's challenging. It's, oh my gosh, why do we have to do something different? Why can't we just keep it the way it is? Well, we all know that progress requires change, but if you take it in small bits, which is what we're trying to offer, eventually that change becomes the norm, right? But again, we're not changing anything here. We're just giving you an option to access information. All right, next one. But we access retirement homes using Senioropolis, Comfort Life, Pearl's Choice, A Place for Mom, and oh, the most powerful Google. And I've asked the same question. But just having a name does not provide the right connection. You will still need to find out the levels of care, the availability. You're going to have to do recalls back and forth or voicemails, let alone sending and receiving a fax. All of this may take hours. And if we have any workers, social workers on with us that can attest to how long that takes, it's quite time consuming, right? So as we shared earlier, these results are for paying advertisers, may take hours. So Google, A Place for Mom, Comfort Life, Pearl's Choice, and Senioropolis. All of those results, as we mentioned, are paid advertisers. So as you should know by now, if you go on Google, the top 3 results are paid advertising, right? So why would you go to a paid advertiser when what you're really trying to find is the organic results, right? So if you're not offering them that organic result or that unbiased result, are you really offering your patient all the available options? So using the vacancy program will reduce this process to mere minutes. All right. Next one. Can't I just call my manager for their list of homes? So as a social worker or discharge planner is dealing with a patient, they may say, well, forget that. Nancy has a list of homes that she normally uses or locations that she normally uses. I'm just going to go ask her for her sheet. Okay. So although your senior colleague may have experience with certain solutions, their caseload and ability to access or be aware of updated information may offer you a challenge, because each patient's situation is unique and will require additional information to perform a qualified search and transition. You would be best off performing your own search to ensure that the patient you know is offered the best solution. So vacancies themselves are a well-guarded secret, and only the home itself could possibly offer that information. I've done a lot of work in the transition part of business. The more you know, like the more face-to-face interaction you have with the individual at the location or at the home, the better results you're going to get, or the better availability you're going to get. Okay, and don't forget, their doors are always revolving. So although there may not be a vacancy today, they should then be able to post when a vacancy does come up and be able to offer it to your type of patient. How can I offer a discharge solution to an out-of-town patient? The only way to do this is to spend time researching. So if you don't take the time researching, your answer is going to be, oh, well, I'm sorry, I can't help you with that. You're going to have to talk to somebody locally to get that information. Well, isn't it better to use a solution that is unbiased, Canada-wide, and contains information pertaining to professional use? That's delivering solutions to your client, right? So again, if you're in Toronto and they have spent 4 hours to come in because the specialist or the healthcare being provided to them is unique to your hospital, you may not be familiar with small town 4 hours out. Through our system, you would be able to pull up information based on that town or those surrounding areas. Okay. Last one for this one. Why do we need to change what we are already doing? Again, change is difficult, right? So the point here is you don't have to change what you're already doing. Keep doing what you're doing. We are simply giving you one more tool in your toolbox to do the job you do every day, only better, more efficient, and unbiased. Esther, I see you're back. You're okay?
I'm back. Yeah.
Good stuff. All right, I'll just continue here.
Yeah.
So we're going to come to this section where we're trying to identify who the ideal patient is. And I know this is a lot of information. It's just Esther and I just talking right at you. Hopefully you're writing down questions and concerns so that we can get to those after this section. So we're trying to identify who the ideal patient is. So in our opinion, it's a patient that is medically stable, financially capable, and requiring a certain level of support or care over and above what the LHIN or the public sector can provide, and is unwilling or unable to return home due to emotional, physical, or mental factors, yet meets the qualifications of the solution provided, but definitely not one who is long-term care eligible or does not want to go the long-term care route. Okay. Recovery from certain types of surgeries, hip, knee, anything that requires respite, short stay. When we get an older couple, quite often they can recover better if they're together, or one can recover better if they're still together. There are options to have dual occupancy in some of these solutions. All right. Also, we're looking at acute cognitive impairment, vacation care, where a family may be scheduled to be away or can't offer care, or to take the patient home or offer care to them while they're at home. It's constantly a challenge for families because most families are unable to offer adequate care. The caregiver or the partner is frail, or when the paid home care costs exceed the short stay costs. I'll repeat that one. When the paid home care costs exceed the short stay costs. And that goes back to, do you think that it's too expensive? Okay, because we do the actual placements and care planning for individuals at home, we have to take into account all the details that would enable that individual to recover or to have an improved quality of life. When we take all of that information in and put a cost factor to it, quite often it's much cheaper to be at a short stay retirement solution. Okay? And of course, we're talking about respite or patient or family caregiver. So as we wind this up, we would ask, who can you think of in the past month that would meet this criteria? And what did you offer them? How did you amass the information you gave them? How much time did it take you? Were you confident they would not return to the hospital in the days following discharge? And how much time would you have saved if you could search up a private care solution through a platform like Senior Care Access's Vacancy Program? Okay. So with that, we're going to open it up to questions. So you're all free to unmute yourselves
There are questions already in the.
And there are questions. It's hard to do all these things here, so
Yeah.
let's see if we can get to them. All
So
right,
one of
let's
the
open up the
questions
chat.
is how often are retirement home vacancies updated by each home? So it's up to them. We do send them reminders. Some of them have said we always have a vacancy, so they have left it as is. I do send the reminders though regularly. Please, if there's any changes to your information, please go in and update it. It's a challenge. Everything is always a challenge with retirement homes, just because a lot of the marketing people are rarely at their desk. So we do communicate with them, let them know when we have new hospitals on board for the pilot and who's going to be looking at their information. We're not asking them the number of vacancies, so that's a really important factor. Where we had an issue was with homes where we started out, we said, well, would you tell us if you had 10 vacancies? And they put their backs up and they said, no, they don't want you to know if they have 10 vacancies. They're okay saying we have a vacancy. So chances are, if it hasn't been updated since March, those vacancies, there's still a vacancy in their system. And so they don't need to keep updating it. We will continue to remind them though.
Yeah, can I just add to that, Esther?
Yeah.
So the retirement homes themselves, they have a branding image that they have to maintain. It's a well-guarded secret as to what their vacancy percentages are. And depending who you talk to, if you talk to upper management, oh, they're close to 98 or 100% full. If you talk to the actual workers, personnel, they know what their actual vacancies are, okay? So really, the homes that are accepting to be part of the vacancy program have indicated that they would be able to regularly offer a vacancy. Okay.
Okay, so next question is, would retirement homes be willing to accommodate isolation, like MRSA, VRE, or responsive behaviors? So we already added a question about mental health issues. You've just given us one more thing to add to our questionnaire. So what I'm going to put on the list today for our web guy is to add a question around accommodating people that require isolation. So that will be added. We have also added something around dialysis. Somebody asked about dialysis. So
Right.
when we get feedback from the hospitals asking for certain questions that we don't have an answer to, we then will add that to our database. The next question is, what % of retirement homes are choosing not to participate, and why are they opting out? So at this point, we have about 40 involved, and we only approached homes in Toronto. I would say there's probably about 55 to 60. So why some chose not to respond? Well, we have corporates there are some corporates that just don't want to be part of anything. And it's a really difficult thing when you're on our end of things. But you have some corporates, it's not the individual homes, it's the big guys that say, we don't need our information anywhere but on our own websites. And they don't want to provide the public with that kind of information. I guess they want you to call rather than be able to access it online. So it's for various reasons, but at this point, we've only approached the Toronto homes. Now, even if we don't have vacancy information, we do have information on every single home in the province. So we have amassed information from several very reliable sources. And that is the information that you will find on every home out there. The restriction is in terms of the vacancy program. Everything else, though, is there. And thank you for the suggestion that we add to our terminology other allied health disciplines. We talk about transition and discharge staff, but of course there are other disciplines that are also involved in this.
Yeah. Esther, can I just throw in here again?
Yeah.
So let me just answer the first part of the question a little bit more. I'm a little bolder than Esther, so I'll say this. So when we're talking to corporates or higher ups of the retirement home industry or the marketing department themselves, they have been bitten, shall we say, and they're quite shy from certain service providers that may or may not have been mentioned in this presentation. And they are looking at not wanting to have a negative relationship with another organization. So some of them have now decided that they don't need third-party assistance and that they're going to do all the marketing themselves. Not all of them do that, but that has come up and is coming up in conversation more and more. And it'll be really interesting to see, I would say probably in the next year and a half, as to where their view goes with this particular organization. Okay. The second part regarding to the terminology when addressing possible users. So we're still learning who the players are in the public sector. It's been quite interesting, and similar to the private sector, there are people in certain positions that may or may not want change, let's just put it that way. And as we discover who the players are, those players act and react and interact with us quite differently from hospital to hospital. So if we're talking to a discharge planner, we've had that situation where we mentioned that to a location, and the response was, well, our discharge planners don't deal with that part. Okay, I don't understand why, but okay, that's the case. Here you mentioned nurses. Would nurses be involved in this piece? If your hospital, that mandate is for the nurse to have this conversation or to gather, collect this information first, then perhaps in your situation, this might be something that we would have to present to them as well. So right now we're trying to hit the key people, the key aspects who would be using and benefiting the program. Hopefully that trickles down to the rest of the workforce as that particular location sees best.
Okay.
Okay.
One more question. Paul, you're going to like this one. Who are the consultants that our patients and families are connected to via the consulting service access point, and what is the fee for the consulting?
You or me?
You, go for it. I know you like this one.
All right, so the consultants, first up, Esther heads the consulting side of things. And then secondly, it's headed by myself as well. I typically deal with the physical and the transition piece. Esther deals with the emotional and health requirements that might be needed. And then we also have several independent consultants that work with us. And depending on the need of that family, we would then bring them on in that case as well. We are looking for more consultants, and the goal is to have 2 or 3 consultants per LHIN territory. Okay, so as we grow this, that's what our goal is for that. We see the consulting side to be a huge benefit to not only families, but to professional users who are working with families, as they may not have the answers or have limitations as to how far they can work with the client. So that's a great opportunity to say, listen, there's an organization that we're familiar with. Here's what they do. Here's a brochure. Here's the website. You can contact them that way. To answer the last part of that question, because it is a fee for service, we estimate that the minimum that we were going to put in for an individual or a family would be about 10 hours, 10, 12 hours. So our minimum starts at 1,500, and we've had it go up to about 9,000, depending on what they needed for us to do. But here's the trick of what we do. We offer a free 1-hour consultation, and through that consultation, it's a discovery process. We'll come back with the facts that we've gathered, and we will present the family or the individual with an action plan. That action plan is different for everyone, okay? Depending on the action plan, we would then come up with an estimated price. Any third-party involvement is an additional cost as per the third party. And then they would sign the contract with us, and then we would begin to implement that plan. Okay. Unlike some other services where they offer a free consulting program, the only reason why it's free is because they are getting paid by a third party. So again, we're being unbiased with it. Somebody has to pay the service. They're being very biased with it. The consumer doesn't pay, but the solution has to pay. And that's where the industry is having trouble with right now. Okay. Esther, you can take this next question here. Esther, you there?
Can you hear me?
Yep, now we can.
Okay, now you can hear me. Okay.
Yes.
I'm having a hard time finding. Okay, what are the fees for professional users? And what would the cost for multiple users via one hospital? And then to clarify Stacy's point, our transition team at St. Joe's is made up of social workers, OTs, and RNs, and 3 physios. There's also transitional planner role called nurse navigator. Not frontline nurses, but nurses.
Gotcha.
Okay, so that's where that question came from.
Yeah. Right.
Have you considered providing a trial access to LHIN district coordinators? They can support client families before they end up in hospital or when service plans are not enough.
Yeah. Let's go backwards on this one. So regarding the LHINs, they may be aware of us, but we have not approached them. We're trying to do the pilot program so that we can get the information, gather the data that we need to then be able to go to them and say, listen, here's what we've done. Here's the information. Here's the data. Here's how it can be implemented. Let's now sit down and take a look at it. Okay. It's just something that we're trying to build organically as opposed to, boom, let's just hit the LHINs and they take it over and away we go. Might not be the right solution for several people's models, but that's basically where we are with it.
The other thing is because of the transition right now with the LHINs, I think it would be really, really challenging to introduce something new. I think in terms of the LHINs, we need to wait until things settle and the new organizations are created. Hopefully by then, timing-wise, we will have data from the hospitals that we can then comfortably go to them with and say, this is what we're offering, this is what works, this is what doesn't. It'll just make it easier for them to come together with us if we have data to give them with it. And the other question that was just before this was the membership. So currently our membership cost is, if you have an individual user, it would be $500 for the year. When it comes to a hospital, we would need to know how many people are involved, and then we could make up a package price. So if you consider in the long run, if this saves hospital days, which we're hoping it does, if it saves bounce backs to the emerge, which again, we're hoping it does, it may be a no-brainer for hospitals to take this on. It really isn't, it's not meant to be super expensive to be a cash grab. It's about providing access to really good data that makes things flow smoother and makes transitions easier for patients. So if you guys like using it and it works really well, then, you know, when the pilot's over, we sit and talk about what this looks like for your hospital.
Yeah.
Yeah.
Okay. Any more questions there? Go ahead.
I don't hear anything. Does somebody,
No, I thought
everybody's
somebody
still
talked
muted.
there.
Do you want to unmute?
So they should all be able to unmute themselves, but I can unmute everybody. Ready, everyone? Here we go. Okay, you're all unmuted unless you've specifically muted yourself. Okay, so with that, we're still open for questions. You can email us. Our information's on the screen there. We look forward to communicating with you as to how you might be able to put this pilot project in place. We're happy to answer more questions. We're very open. We want it to work, so we will take what you have to say or suggest to heart and try to work with it. And that's really what we want out of this. Okay. You know, as Esther was talking and as I was reading through the questions, there's so much more to all of this than just the vacancy program. And even for myself in working with families who are struggling with their adult parents, who really have no idea what's coming down the line, where to go, who to call, the word, the LIN, most people still call them CCAC. There's complaints, you know, it takes too long, there's this, we don't get enough care, who's going to come, where do I turn to? They don't even know that there's an opportunity to actually talk to somebody or to consult with an organization that can help navigate all aspects of it. And we've put a tremendous amount of time, effort, resources, and funding into the programs that we develop. And even as you heard me talk about the real estate side of things, even the certified executor advisor organization that we're part of, it's all meant to put the answers in place and then be available for those that need the assistance. So specifically, we were talking today about the vacancy program. In reality, the entire program is so much more than that, but we're introducing this to you so that we can continue the innovative programs that we're building on and provide those services to empower those families moving forward. So, okay, so with that, if there's no more questions, Esther, do you want to close out with anything, or are you good?
I'm good. What I'll do is I will email all of you the recording of this once it's up on YouTube. And if there's anything in terms of that feedback form, if people are having issues with it, if you would prefer that we have a different way for feedback, by all means, please let me know that. Because we will be coming back and saying, can you tell us what we need to fix or what's working for you? Oh, wait, there's one more message. Hold on. Oh, you're welcome, Stacy. Stacy says thank you.
Okay, perfect. We are over time, but those are great questions. We never know how long the questions are going to be. So with that, thank you very much, everyone. Esther, thank you once again. We'll talk to everyone soon. Thanks.
Okay, bye-bye.